This recording will go over Chapter 46, Medications Used to Treat Disorders of the Thyroid Gland. The thyroid gland is an important regulator for many of the bodily functions. Thyroid hormones affect every cell and all organs of the body. If I were speaking generally, I'd say the thyroid's main function is to affect metabolism. Low thyroid hormone levels lead to low metabolism in the body, where high thyroid hormone levels lead to an excessive or high amount of metabolism in the body. Thyroid hormones do many things, including regulating the rate at which calories are burned, affecting weight loss and weight gain. They can slow down or speed up the heartbeat, raise or lower body temperature, influence the rate at which food moves through the digestive tract, control the ways muscles contract, and also control the rate at which dying cells are replaced. The three hormones produced and secreted by the thyroid glands are T3, T4, both of which help with metabolism, and to a lesser extent calcitonin for regulating serum calcium. The thyroid gland uses iodine from food to make two thyroid hormones, T3 and T4. It also stores these thyroid hormones and releases them when they're needed. If levels of T4 and TS are low in the body, the hypothalamus releases thyrotropin-releasing hormone, TRH, which stimulates the pituitary gland to release thyroid-stimulating hormone, TSH. TSH then causes the thyroid to release T4 and T3 to bring those levels up to normal, hopefully. On the other hand, if the levels of T4 and T3 are high, the hypothalamus will quit producing TRH, which leads to then TSH not being produced, right? So the thyroid stops producing as much of the T4 and T3, which can help bring those thyroid hormone levels down back to normal. Hypothyroidism is a decrease in thyroid hormone secretion. Hypothyroidism can have a primary cause when there's a problem with the thyroid itself, a secondary cause due to lack of TSH from the anterior pituitary gland, or a tertiary cause due to lack of TRH from the hypothalamus due to a hypothalamus disorder. Primary hypothyroidism, a problem with the thyroid gland itself secreting the T4 and T3, occurs most frequently. Decreased T4, so the hormone level is low, and elevated TSH, so the body is realizing this hormone level is low and is causing the hypothalamus to release TRH, pituitary gland to release TSH, and it's just not working well. So in primary hypothyroidism, when the thyroid's the problem, your hormone's low, but the anterior pituitary TSH is high because it's trying really hard to get that thyroid to get those hormone levels where they need to be. The causes of hypothyroidism include acute or chronic inflammation of the thyroid gland, radioiodine therapy, excess intake of antithyroid drugs, or surgical removal of the thyroid gland. Myxedema is severe hypothyroidism in the adult. Symptoms include lethargy, apathy, memory impairment, emotional changes, slow speech, a deep, coarse voice, edema of the eyelids and face, dry skin, cold intolerance, slow pulse, constipation, weight gain, and abnormal menses. And if you think again just in general of what happens with hypothyroidism, that is turning the metabolism down, a lot of those signs and symptoms make sense. So we're turning things down: slow speech, memory impairment, lethargy, cold intolerance, right? Because when my metabolism's high, I'm hot. So with hypothyroidism, I have cold intolerance, I'm cold. Slow pulse, constipation, food is moving through my GI tract slower. Weight gain with a lower metabolism, the patient's at risk to actually gain weight. Exogenous thyroid hormone replacement is contraindicated in patients with thyrotoxicosis, which is a condition of hyperthyroidism, acute MI, and adrenal insufficiency. Because thyroid hormones are catabolized by the hepatic system, drugs with hepatic enzyme-inducing properties, such as carbamazepine and hydantoins, should be used with caution. Levothyroxine sodium is your prototype drug that is used to treat low thyroid hormones or hypothyroidism. The brand name for levothyroxine sodium is Synthroid, like synthetic thyroid, so that can sort of help you remember what it's for. Levothyroxine sodium is the drug of choice for replacement therapy for the treatment of primary hypothyroidism. It increases the levels of T4 and metabolically is deiodinated to T3. Levothyroxine is used to treat simple goiter and chronic lymphocytic or Hashimoto thyroiditis. In terms of patient teaching, it's important to teach your patient that the drug should be taken, levothyroxine sodium, should be taken on an empty stomach at least 30 to 60 minutes before breakfast. And again, just thinking about hypothyroidism in general, we know is when the metabolism is turned down. So in this case, we're giving the patient a medication, levo or levothyroxine sodium, to turn that metabolism back up. So knowing that, some of these side effects are going to be easier to remember. So we're turning the metabolism up with this medication. Side effects include nervousness, headache, insomnia, right? Everything's getting increased, insomnia, weight loss because our metabolism's increasing, tremors, GI distress, tachycardia, heart rate's up, hypertension, blood pressure's up, and some other cardiac issues here, dysrhythmias, palpitations, angina, and then finally a thyroid crisis just due to an imbalance of that thyroid hormone. So now we're going to talk about hyperthyroidism. In hyperthyroidism, there's an increase in circulating T3 and T4 levels, which usually results from an overactive thyroid gland or excessive output of thyroid hormones from one or more thyroid nodule. So knowing what we know about how thyroid hormones affect metabolism, with hyperthyroidism, do you expect the patient's metabolism to be low or high? With hyperthyroidism, the patient's metabolism is going to be high. Hyperthyroidism may be mild with few symptoms, or it may be severe, as in a thyroid storm, in which death may occur from vascular collapse. Graves' disease, or thyroid toxicosis, is the most common type of hyperthyroidism caused by hyperfunction of the thyroid gland. It's characterized by, so a lot of these make sense when you think about hyperthyroidism as an increase in metabolism. It's characterized by rapid pulse, palpitation, excessive perspiration, heat intolerance, nervousness, irritability, bulging eyes or exophthalmos, and weight loss. Hyperthyroidism can be treated by surgical removal of a portion of the thyroid gland, radioactive iodine therapy, or anti-thyroid drugs, which inhibit either synthesis or release of the thyroid hormone. One thing to note is when a patient has a thyroidectomy or receives radioactive iodine therapy, it frequently leads to permanent hypothyroidism, and the patient has to take thyroid replacement therapy, such as levothyroxine, in order to replace those thyroid hormones. Propylthiouracil, commonly written as PTU, and methimazole are effective antithyroid drugs. They are used to control overactive thyroid due to Graves' disease, toxic nodular goiter, or multinodular goiter. They are also used prior to radioiodine treatment or thyroid surgery. One way to help remember that propylthiouracil, or PTU, helps to bring down thyroid hormone levels is to think of PTU standing for puts thyroid under. So that PTU is a medication that is used to bring down those thyroid hormone levels. Methimazole does not inhibit peripheral conversion of T4 to T3 as does PTU. However, it's 10 times more potent and has a longer half-life than PTU. It is the preferred antithyroid because it has less severe side effects. Prolonged use of these antithyroid drugs, these thiamides, may cause goiters because of increased TSH from the pituitary gland and inhibited T4 and T3 synthesis. Also, strong iodide preparations, such as potassium iodide, have been used to suppress thyroid function for patients who are undergoing subtotal thyroidectomy because of Graves' disease. Antithyroid drugs interact with many other drugs. When used with oral anticoagulants such as warfarin, they can cause an increase in the anticoagulation effect, so that puts the patient at increased risk for bleeding. In addition, thyroid drugs decrease the effect of insulin and oral antidiabetics, putting the patient at increased risk for high blood sugar. They also decrease the effect of digoxin and lithium increase the action of thyroid drugs. So digoxin and lithium increase the action of thyroid drugs. Phenytoin increases serum T3 levels. In terms of assessment, we want to assess the patient's thyroid hormone levels, T3 and T4, and also TSH. We want to get a baseline of vitals and look for any changes in weight. We want to assess for signs and symptoms of thyroid crisis or thyroid storm, including tachycardia, dysrhythmias, fever, heart failure, flushed skin, apathy, confusion, behavioral changes, and later, hypotension and vascular collapse. Thyroid crisis can result from a thyroidectomy, which causes an excessive release of thyroid hormones, or from abrupt withdrawal of antithyroid drug, excessive ingestion of thyroid hormone, or failure to give antithyroid medication before thyroid surgery. So a thyroid crisis occurs due to high levels of those thyroid hormones. In terms of planning, we hope that the activity level will be improved within 1 to 4 weeks of thyroid treatment. In terms of nursing interventions, we want to record vital signs. With hypothyroidism, temperature, heart rate, and blood pressure usually are low. With hyperthyroidism, tachycardia and palpitations can occur. We want to monitor the patient's weight. Weight gain is commonly seen in patients with hypothyroidism because their metabolism is low. We want to monitor labs, including the CBC, CMP, liver function tests, and ECG. We want to report periodic TSH, T3, and T4, so we want to continue monitoring those throughout treatment. In terms of patient teaching, we want to teach the patient to take the drug at the same time each day in relation to meals. We want to teach them to read warnings for over-the-counter drugs. So make sure they're reading labels before taking OTC drugs. Direct patients to report symptoms of hyperthyroidism, such as tachycardia, chest pains, palpitation, and excess sweating that can be caused by drug accumulation or overdosing. Instruct patients that certain foods can interfere with the absorption of thyroid hormones, such as soy products, cruciferous vegetables such as broccoli and cabbage, iodized salt, and shellfish and coffee. Instruct patients to take drugs as instructed. Abrupt changes may lead to increased thyroid dysfunction. Demonstrate to patients how to take a pulse rate and instruct the patient to monitor their pulse rate and report increases or marked decreases in the pulse rate. Teach patient the side effects of antithyroid drugs such as skin rash, hives, nausea, alopecia, loss of hair pigment, petechia or ecchymosis, and weakness. The patient should contact the provider if they have a sore throat or fever while taking antithyroid drugs, and CBC should be monitored to monitor white blood cell counts, as antithyroid drugs can lead to agranulocytosis.